Okay, so I'm going to start my introduction again. I am Dr. Yogita Tailor. I'm a physiatrist working with Pelvic Rehabilitation here in Atlanta, Georgia. As a physiatrist, my specialty deals with function, not necessarily an organ system, but function and helping patients get through chronic pelvic pain as well as dysfunction. It may not necessarily be painful to help improve quality of life. How is everyone doing today? All right, and I'm getting good feedback that sound is improved and people are still starting to join in, so we'll give it another minute or so to let everyone come on in. All right. Everyone having a good day today? Good. And again, I want to make sure this is as informal as possible. Feel free to ask any questions or any comments, and we can talk about uterine fibroids today. All righty. All right. Hi, everyone. I still see a few people joining in. We'll give it another minute or two, or maybe just another minute, and we can always backtrack if needed. All right, so uterine fibroids. So what are they? They are, and honestly, uterine fibroids actually have a couple of names to them. You might have heard people say myomas or leiomyomas, and that can also sound a little scary. But a uterine fibroid is a growth, it's kind of like a tough ball of muscle that's growing from the uterus. And just for anyone out there, just in case there's a little confusion on what the uterus is. So uterus is also known as the womb. It's where, for pregnant women, that's where the baby's growing. And the uterus itself is actually a muscle. It's a smooth muscle. So again, muscles contract, and a fibroid is actually a little bit of overgrowth of that muscle tissue. And some people will also call fibroids as tumors. And an important thing to point out today is that fibroids are non-cancerous. They're just a little abnormal growths of the muscle of the uterus. Tends to happen more in women of reproductive age, so in their teens to their 40s, but it can be a little bit different for everyone. And sometimes the uterine fibroids are small, and sometimes they're big, and sometimes some people have multiple uterine fibroids, and for some it's just a few. And it's probably the most common abnormality of the uterus, and approximately 80% of women will have fibroids in their lifetime. And sometimes people will know, and sometimes people won't know. Sometimes there are symptoms, and sometimes they're not. So going into what potentially can be a symptom of a uterine fibroid. And like I said, sometimes there's no symptoms at all. So sometimes the uterine fibroids can cause heavy or long menstrual bleeding. Sometimes they can cause some reproductive issues such as infertility, or sometimes a higher risk of miscarriage. And occasionally they also cause kind of the bulk related symptoms. So especially if there's multiple, or if there are a great number of them, they can tend to get heavy, and that can cause pressure onto the pelvic floor and guarding of the muscles. So as we start introducing the pelvic floor, I'm going to bring in a friend of mine. This is the pelvis, okay? And in the pelvis, there's a few different things. The bowels, which kind of fell off a little bit. We have the bladder right here for urination. And then inside we also have the uterus. And again, this is the uterus where there can be the tissue overgrowth. And I'm going to show you a little other diagram too to show what the fibroids can look like in relationship to the uterus. But again, going back to this pelvic floor, there's a network of muscles down here, and there's actually multiple different layers of muscles that hold everything in there. And so when I talk about those bulk symptoms, it's because this pelvic floor is holding a little bit more weight and more pressure than what it's accustomed to and what it's supposed to be doing. And so with these weight symptoms, you can feel kind of this dull pressure that kind of lingers throughout time. You can also have some back pain. You can even have some urinary pain, because as I showed you, the bladder is right there and can interfere with urinary. So if there's a fibroid that's pushing against the bladder, some of those urinary symptoms can include having to go to the bathroom more often, some difficulty with emptying because there's extra pressure there, or even that urgency where you gotta go right now. Other bulk-like symptoms can be dealing with your bowels. So the fibroids can push on the rectum. The actual tensing of the pelvic floor muscles can also push on that area and lead to constipation. You can also have painful periods, as well as painful intercourse, again, because of that those muscles have gotten tight, aggravated, and irritated. So I'm going to bring in this diagram right here. So again, this is our friend the uterus, which is going to be inside of our pelvic area. And there's different ways that the fibroids can project. So there's different, it could be on the inside, it can be right on the outside, or even more outside. And that can also affect the types of symptoms that you have. So who is at more of a risk for developing fibroids? Like I said, this can be a pretty common diagnosis in reproductive age, but some women have a higher risk for getting fibroids than others. Studies have shown that race can contribute, where Black women have 2 to 3 more times likelihood of getting a fibroid compared to white women. It's unknown why this specific risk factor is there. It could be genetics, it could be diet, it could be even environmental stress. In terms of the Latina population, it's a little bit mixed. Some studies show that there's a higher risk of fibroids in the Latina population, and some show that there's a little bit less risk. Pregnancy actually decreases the risk of fibroids, and that can also depend on kind of the pregnancy affecting the contour of the uterus and kind of suppressing that fibroid. Early start of periods actually is associated with a higher risk, especially getting your period before the age of 10. There's questionable risk with obesity, where our more obese population may have a higher risk for getting fibroids. Again, there's that genetic predisposition, and that was a question that was asked, where if you have a family member with fibroids, am I more likely to have fibroids? And it is possible. There's no great hard evidence to say that certain genes will cause fibroids, but having a family history is important to know. And then there's the dietary component. So red meats and high sugary foods have been shown to have possible increased risk of fibroids, and an interesting study actually showed that dairy intake may decrease that risk. So again, I know people are still joining in. Again, we're talking about fibroids, and again, if anyone has any questions throughout this, feel free to ask. So we talked a little bit about what fibroids are, and emphasized that they are non-cancerous growths within the uterine tissue. We talked about some of the symptoms of fibroids, which, again, you can have abnormal or increased bleeding. You can have some fertility and pregnancy issues. But again, a bulk of what we treat here at Pelvic Rehabilitation Medicine are those bulk symptoms, that constant dull pressure, sometimes that feeling, the urinary correlation, where you may have to go to the bathroom more often, or there might be some difficulty going to the bathroom. The bowel symptoms of constipation, sometimes pain with intercourse can be related to fibroids, because again, they're putting pressure onto the pelvic floor. And when there's constant pressure onto the pelvic floor, the muscles just kind of want to tighten because they're guarding, they're trying to protect themselves. And within that pelvic floor is also a network of nerves in there. The nerves are providing sensation into that pelvic area. And when those nerves are constantly squeezed, they get irritated. And that irritation can cause pain, as well as burning pain, nerve pain. And sometimes, again, when you're dealing with this for such a long time, there's that sensitization aspect. And sensitization is kind of a fancy word where your pain is taking over. It's not just involving the pelvis anymore, but it's taking over your mood. It's affecting your anxiety. It's affecting your relationships. It's affecting your job and your ability to kind of function in the way that you want to function. And so those are important. Those are some important signs that we'll see. So in terms of getting evaluation for fibroids, so important thing is always getting a good history. As a physician, I do spend a lot of time getting a good history for my patient and trying to figure out what's been going on. And this can be evaluated by a gynecologist, as well as, again, a physiatrist like myself focused on pelvic pain. So the history, we like to ask about the pain. Where is the pain? How severe is that pain? What's the quality of the pain? Is it dull? Is it pressure? Is it sharp? Is it dependent on position? And how long is the pain been going on for? Did it kind of come up all of a sudden, or has it kind of gradually been increasing? And an important question I like to ask on my evaluation is, how is this affecting your quality of life, right? Where, again, like I said, these fibroids are not cancerous, they're not dangerous. However, they can impact your quality of life so significantly. And then the next step is the physical exam. Physical exams can detect a uterus, especially you can find a large uterus with kind of a regular shape. And it can also be detected on ultrasound exam, and also by MRI as well. And I know the big aspect of a question that was asked is, what can we do to treat the symptoms? And again, the majority of the symptoms I'm going to talk about today are those bulk symptoms, those painful symptoms. And again, we're talking about a pelvis that's kind of being irritated, has constant pressure, and so the muscles are kind of squeezing and causing a lot of tension, irritating the nerves. And so a lot of the biggest ways to reduce the symptoms are helping to relax those muscles and get those nerves free, and kind of rehabilitating that pelvis into becoming more of its natural shape and pliability. So some easy things that can be done at home include applying heat, over-the-counter medications such as an anti-inflammatory ibuprofen or Tylenol, some relaxation techniques. So breathing is a very important relaxation technique. And over time, a lot of us have developed kind of wrong breathing habits. So actually when we breathe in, our belly should be coming up. So our belly should be inflating, and then with each breath out, our belly should be getting smaller. So that's belly breathing, and that helps to, again, relax that pelvis. Other things include yoga. And when I talk about yoga, it's not the contorted positions, but more kind of restorative yoga, where, again, we're down training that pelvis, we're opening up that area and helping to relax those muscles. And sometimes we don't even know that these muscles are super tight, and we may even be contributing to that. When we get anxious, we tend to clench our body, we can clench our jaw, we can clench our shoulder girdle, as well as our pelvis. And so working on being mindful of avoiding that clenching can also be very important to help reduce that guarding sensation when dealing with the pelvic floor. And for some people, again, doing these home exercises may not be enough, and some people will benefit from seeing a pelvic floor physical therapist. And a pelvic floor physical therapist will work with you one-on-one to help with relaxing that overactive pelvic floor muscles. Sometimes there's internal work as well as external work to help get through the different layers of those, the pelvic floor muscles, as well as teach with down regulating with that. Other things to add in may include medications, and some medications that can be beneficial for the bulk symptoms include muscle relaxants as well as nerve pain medications. And oftentimes patients can do really well with these muscle relaxants and or nerve pain medications through a suppository, which can be inserted vaginally or rectally, as opposed to medications taken by mouth. And by using it as a suppository, we're in greater proximity to the pelvic floor, where the medications can help this area a little bit more directly. And other medications that maybe a GYN may also consider include hormonal type medications to help with the bleeding aspect of it, including birth control. And then for some of the other symptoms, again, when the pelvic floor is addressed, however, the bulk of the fibroids may be a little bit more pressure, more direct pressure. Sometimes a surgical option may need to be considered, and there are a few different surgical options which an expert surgeon can help delineate which one would be the ideal one for you. So you can have surgery to specifically remove the fibroids, and that's called a myomectomy. And in a myomectomy, it's just the fibroid that's removed and the uterus is kept in place. It can be effective, but it may not be permanent because sometimes the fibroid can come back. But it can be a good option for those who still want to maintain fertility. There's also treatment where you can cut off the blood supply into the fibroids, and that's called a uterine artery embolization, or it could also be called a uterine fibroid embolization. And during this procedure, the artery into the uterus there's a thin tube that's inserted into the artery in order to help decrease that blood supply. And so the uterus is no longer getting the blood into that area, so the fibroids start to shrink. Again, and it's dependent on the surgeon to determine if you would be a good candidate. For fertility purposes, this would not be a good idea, as again, you would want blood flow into the uterus if you're trying to conceive. And then another surgical option can be surgery to remove the uterus in itself, and that's called a hysterectomy. And for that, you're removing the fibroids as well as the uterus itself, and it minimizes the risk of having the fibroids come back because you don't have a uterus to begin with. And but again, for those patients that are trying to conceive, this would not be an option. And again, the goal for our treatment, especially the pain treatments, is improving quality of life. And again, the fibroids in itself can affect relationships. It can affect employment and overall health. And so our goal as physiatrists in dealing with symptoms related to fibroids is essentially making sure that you have the most optimal quality of life. Because again, there's a lot to it, and in fact affecting your bowel, your bladder, intercourse, and those are kind of very important things that need to be addressed. Have one question that asks, are fibroids genetic or hereditary? And again, we did touch upon this. Fibroids can have a genetic component. There are multiple studies that are looking at certain genes that may contribute, but overall there does seem to be a genetic predisposition in terms of family if there's a risk for fibroids. What else? What other questions do we have? I'm just going to scroll to make sure I didn't miss anything. we can do to reduce symptoms, and that's what we talked about. Okay. Okay. All right. Any other questions? And I know fibroids can be a little bit confusing because, again, when you think about fibroids, you know, oftentimes people know patients that have, or family members or friends that have fibroids, and how it can affect quality of life. And so that is definitely the main thing we want to optimize here. And something interesting about fibroids is that with change in age, sometimes the fibroids can actually get smaller. As we hit menopause and the hormonal component changes and there's less estrogen, the fibroids may actually begin to get smaller. It may not be as bothersome later down the line. But again, think about that pelvic floor. If those fibroids have been sitting for a long time, causing that chronic pelvic pain, the urinary symptoms, the bowel symptoms, that in itself can be difficult to the symptoms undo just with the shrinking of the fibroids, only because the muscles and the nerves have been used to being in that chronic guarded state. And so even if the fibroids themselves are smaller or have been removed, we don't want to forget about that pelvic floor that's been kind of bearing the weight and the bulk of those pelvic floor muscles. Someone asked, how do you diagnose a fibroid? So good question. We touched upon that a little bit earlier. And there's a few different ways to diagnose a fibroid. One can be initially through physical exam, where oftentimes the gynecologist will do a bimanual exam and feel the uterus. And oftentimes with fibroids, you can have a large, bulky uterus and abnormal contours. But another way to diagnose a fibroid is through an abdominal ultrasound, where you can see the different areas of the growths, as well as MRI can be used to distinguish if there's a question, if there's a fibroid or something else. An MRI can help delineate that information. Okay. What else? What other questions do we have? All good questions here. And some, I know some of our viewers joined in a little bit late, but I'm happy to answer any more questions if anyone has any. Okay. All right. So it was wonderful to get a chance to speak with you all about uterine fibroids. I look forward to doing something like this again, and maybe we can talk about different topics. So if there's any specific topics anyone else may be interested in related to the pelvic floor or pelvic pain, we would be happy to touch upon that as well. I had a question. So the last question, it says, why do fibroids burst? Fibroids typically don't burst. Again, like I said, they're made of muscle. So you may be thinking about cysts. Cysts are completely different from fibroids. Cysts tend to occur right outside the ovary, and cysts in general, again, there's different kinds of cysts, tends to be little sacs of fluid. And so if the fluid is expanding or if there's changes, that in itself can burst. So typically fibroids, you won't hear about fibroids bursting. You can hear about them growing or even getting smaller, but they may not necessarily burst. But good question, because again, like I mentioned, there's a lot going on in that pelvis, a lot of structures in there, and I'm happy to clarify any questions. Thanks so much. Bye-bye.